Hi, this is Andrea Kane, and we are now in week 2 of summer 2020 for medical terminology, and this is the 4th video for this week. We are looking at, drum roll please, yes, radiology and nuclear medicine. We've been talking about gastrointestinal systems, the digestive system, and oncology, cancer medicine, and now we're on to radiology and nuclear medicine. And the reason I put these 4 together is because they are so integrated. A lot of the cancers you'll hear about have digestive system origins, such as your colorectal cancers, your liver cancer, those types of things. And a lot of your radiology procedures you'll hear about have to do with doing an upper GI, a lower GI, abdominal ultrasound, those types of things. So it just seemed to me that when we're looking at chapters to put together for the summer, that they went together well. All right, so we are on to radiology and nuclear medicine. What are we doing here? And here are the chapter goals for this one. We don't have any unit goals in our syllabus for this chapter, which is chapter 20 in your book, but it's well worth us just flying through, taking a look at it, because it only enhances what we were studying with the digestive system and oncology. And these are the rest of our chapter goals, making sure that we understand those terms. So what is radiology? It is the specialty that's concerned with X-rays and other technology like ultrasounds and magnetic resonance, or as we all like to talk about it as MRIs, magnetic resonance imaging. We're trying to produce and interpret images of the human body for the diagnosis of disease. And then there's X-rays that talks about the invisible waves of the energy, and the nuclear medicine where we use radioactive substances to diagnose or treat diseases. We talked a little bit about that in the last chapter, chapter 19, when we were talking about how nuclear medicine is used to treat cancers. All right, some people you will run into in this field are radiologists. There are different types of radiologists. There are interventional radiologists, there are regular radiologists, there are radiologists that focus on women's breast health, there are radiologists that focus on ultrasounds, there are radiologists that work with orthopedic surgeons. There are some that just sit and read x-rays all day on big computers in dark rooms. I have met all these different kinds of individuals, and they are great. Most of them are very interesting people who have just incredible eyesight, whether that's with or without glasses, and they pick up details. They really are able to see more than what you or I would looking at an image. Granted, they've been trained to do that, and they've had many, many hours of doing that, but it's neat to talk to them. You get into the nuclear medicine physicians, you can get into the physicists who calibrate the machines that are used, you get into those that are used to dealing with the nuclides and all of the radioisotopes and different other things. And then there are radiology techs. That's another great field to go into because there are people who learn to do ultrasounds. They can focus on ultrasounds of all different parts of the body, or they can focus on ultrasounds for pregnant women. They can you can be a radiology tech and help place patients and do testing for MRIs, for PET scans, for all different other types of things. And there's even radiology techs that assist with nuclear medicine in oncology areas. So lots of opportunities in this field if you find it fascinating. So what are some characteristics of x-rays? And I will tell you that the old x-rays, like old photographs, if you've ever heard of a Polaroid camera, those are very, very rare in hospitals and healthcare places, clinics, you name it today. Everything is electronic. Everything uses what's called a PACS system. They capture the image digitally, and it's not on an exposed photographic plate. That is something of the past. But x-rays and how they work, it's here. You can read more about it, Google it if you're interested in it, but most of that is all digital these days. But x-rays are still taken, just more of a digital process. There are, you've heard of CAT scans, computed tomography imaging, CAT scans, and contrast studies. You'll hear a lot about an upper GI or lower GI, using contrast to identify different things happening, how things are flowing, those types of things. Fluoroscopy is often used. That's a great one if you want to do a little bit of research on to find more about fluoroscopy. Is used with a lot of procedures. I mentioned earlier interventional radiology. There are radiologists that perform procedures that 10 years ago were done by surgeons, and they become certified as an interventional radiologist and perform those procedures. It's amazing to see those and watch and talk with those physicians. I worked with a couple of those, and it was really neat. So that's another field to investigate if that's of an interest. And then, of course, there's ultrasonography and MRIs, magnetic imaging or magnetic resonance imaging. Now we get into those positions. Remember how was it chapter 2 perhaps, how you had to learn posterior, anterior, lateral, those types of things? Well, you're back to it with x-rays because they have to know how to position patients. And this gives you those. And when you think about it, I'm going to go back one slide. When you think about it, you want to think about how on the screen, I'm going to show you with my mouse, how on the screen, where the imaging is coming from and to. This is where they're capturing the image. This is where the radiation is coming from. So when someone says we need a PA view, posterior to anterior, they mean that they want the ray to hit the posterior first, then the anterior, and be captured there. So if I go on to the next slide and we want the anterior to posterior view, AP view, you want the radiation to hit the anterior first, then the posterior, and be captured. So always think of it as the radiation, the side, and then it's captured. So whatever this side is listed first, that's what you want the rays to hit first, the radiation to hit first. This is what you want the radiation to capture second and be captured, so to speak, digitally. I hope that makes sense. All right, lateral view. Lateral is side to side. So it doesn't really matter whether you're going to do left or right unless they tell you, I want left lateral view. So if they want left lateral view, you want the left lateral view is going to be right here by the capture. Does that make sense? Because this is the patient's left arm, and that's where you're capturing it. Okay? So mentally think, if you're doing a lateral view, if they want the left, you're going to go right to left. Oblique view is that slanting direction angle. And you're going to start with the back and sort of go to the front. It's sort of like a diagonal, I guess, would be a way to explain it. So make sure, remember how we talked about abduction, adduction? Ab meant away, ad meant toward. Extension is flexing away. You know, you're stretching it out. Extension means you're moving it away, X away, and flex is more bending it toward. So you're going to need to remember all those positions. All right, and then patients that are laying down. Okay, you need to remember what decubitus is versus prone versus recumbent versus supine. So practice, practice, practice those. Make sure that you are doing flashcards and that you understand that. Prone is when you're on your tummy, face down. Obstructing passage of X-rays. All right, so if you're obstructing it so they can't see it, hint here, which one of these suffixes means you can't see through it? Lucent means light. Isotope, I'll let you look up. Pharmaceutical means a drug, right? So there's your hint. Moving on to radionuclides and radioisotopes. You have alpha, beta, or gamma. And then you have the two types of nuclear medicine tests. In vitro is a test tube. In vivo is the body. So remember, vitro is test, think test tube, and vivo is body. Some things that they do to analyze blood and urine. And again, go back to this, vitro. When you analyze blood and urine, do you do it in the person's body? No, you have to take it out, you have to put it into a test tube, and that's where you're looking at it. You can't analyze blood and urine in somebody's body. But now, if you're in somebody's body, you can use you can use a radioactive substance and take a look inside their body, looking at concentrates in this particular organ, or doing a particular picture. And those are done in the body. This gives you ideas of things you can use radionuclides with. Goodness gracious, I'm having a hard time talking. I think by the time I get to the 4th video each week, I'm sort of tongue-tied. You'll hear more about cardiolite scans, thallium scans, when we get more toward cardiology. When we study those, the chapter on cardiology, you'll hear more about cardiolite stress tests, thallium stress tests, those types of things. Thyroid scan, probably we'll talk about that in the endocrine chapter. PET scan is a whole body scan typically, and it's done for cancer to see if it's metastasized anywhere. So if you hear about a positron emission tomography scan, a PET scan, that's typically used to see about cancer metastasis throughout the entire body. Those are very expensive, and you definitely have to have clinical justification as to why you're doing those. Typically, you have to have had x-rays and CT and or MRI scans before you can get a PET scan done. They don't usually let you go to say, oh, we're just going to do a PET scan today. Focus on the PET scan. This talks about where it's at. Again, you can see the emphasis on malignancies. SPECT tests. A lot of these are cardiology, looking for ischemia and different things like that, but occasionally they do use them for liver tumors and anything going on with bones or spine. So here's our vocabulary, terms and meanings definitions. Have you ever heard of a half-life? That's the time for it to lose half its radioactivity by disintegrating, which makes sense, I think, if you think about it. And still more terms, more meanings and definitions. Make sure that you know what each of the scans stand for and can spell it correctly. Positron emission tomography, because you will need to know that. Oops, did I go backwards? My apology there. All right. Radio opaque. Remember that from our quiz earlier? It obstructs a passage. If it's opaque, you can't see through it. It's obstructing somehow. And yes, you do need to know SPECT means single photon emission computed tomography, and that it is 3D. Make sure you know those two things. Ultrasonography, make sure you know that. And make sure that you know that ultrasonography, it's those high frequency sound waves. Uptake would be a good one to know, how you're absorbing that radionuclide into an organ or tissue. There are ventilation perfusion studies. They're not often done, but you'll need to know those about the respiratory tract. And we'll talk more about those when we get to the respiratory tract, the respiratory chapter, and that comes right after cardiology. So, which of the following is a handheld device that sends and receives ultrasound signals? Sends and receives. It's not going to be a camera. You know that. And LOGY is study of. Does a study of send and receive? Radioisotope. The part radio is interesting, but isotope is not. Isotope says isotope is nuclear medicine. That screams nuclear medicine. So therefore, the answer has to be hint, hint, hint. And if you're not sure, go back and look. All right, so combining forms. Again, watch out for some of these weird combinations of letters, the OENTG. Fluoro, FLUOR. Watch out for similar letters, vitro versus vivo. Vitro is glass, tube, glass. It's outside the body. And then you've got some suffixes here. Loose, LUC, has to do with light. Anytime you see LUC, it has to do with light in some way, shape, or form. That'll be a good hint for you. And see, abbreviations. Lots and lots of abbreviations here. When you see abbreviations like this, please know they will not be on a test or a quiz, at least not that I'm aware of. It's nice of you to see those and know, but that's not something you're going to need to memorize unless you specifically end up going into the nuclear medicine field. Okay? You heard me mention a PACS system. It's Picture, Archival, and Communication Systems. Most radiology departments have a PACS system. It's where they digitally store all the electronic x-rays and scans and things. And it's where the radiologists go in and they make their, they make their diagnoses and do their reports. So, which term refers to movement away from the midline of the body? Away. This one should be really, really easy. Which term refers to a patient lying on their back? You can get this one, but just make sure you know the difference between these four positions because you will need to know that for a quiz or a test. All right, so we have finished chapter 20. And I am hoping that you have a good week, hoping you have good studying. And if you need me, reach out and I'll get these posted. Take care. Have fun. Bye.